for this JBI webinar. And I'm going to do a short introduction. My name is Dr. Hazel Keedle, and I'm a Senior Lecturer of Midwifery at the School of Nursing Midwifery at Western Sydney University. We've got on this webinar today, we've got Dr. Shija Pathraze, we've got who is a Senior Lecturer of Nursing at the School of Nursing Midwifery, Dr. Jan Foster, and Tanya Stewart, who is a Paediatric CMC at Westmead. So we will get started, and I'm going to do a brief introduction. I'd also like to do an acknowledgement of country. So we would like to acknowledge the many lands of traditional owners of where you are coming from. I'm currently on the lands of the Dalagan Gundagara people here in the Blue Mountains. And we pay our respects to elders past, present and emerging, and pay our respect to any First Nations individuals here today. So in this brief presentation that I'm going to look at, I'm going to introduce JBI, its model of evidence and evidence-based healthcare, and the origins and purpose of the JBI Global Solution Room. At its core, JBI is concerned with improving health outcomes in communities globally by promoting and supporting the use of the best available evidence to inform decisions made at the point of care. This work begins and ends with the needs of those working in and using healthcare services. JBI seeks to respond to the questions and provide high quality, reliable information that is pragmatic and useful where it counts. JBI is an international research organisation that develops and delivers unique evidence-based information, software, education and training designed to improve healthcare practice and health outcomes. To achieve this, JBI works with universities and hospitals from across the globe through the JBI collaboration. In doing so, JBI ensures that the research evidence it seeks to synthesize, transfer and implement is culturally inclusive and relevant across the diversity of healthcare internationally. For those of you who are perhaps unfamiliar with JBI, our vision is to provide better evidence to achieve better outcomes and a brighter future. Our mission is not to only promote, but also support the use of evidence at the point of care globally. But of course, JBI can't do that alone from Adelaide, Australia. So international collaboration is critical, not only to us, but to the broader evidence-based healthcare endeavour. JBI's approach to evidence-based healthcare is unique. JBI considers evidence-based healthcare as decision-making that considers the feasibility, appropriateness, meaningfulness, and effectiveness of healthcare practices. The best available evidence, the context in which care is delivered, the individual patient or consumer, and the professional judgment and expertise of the health professional inform this process. JBI regards evidence-based healthcare as a cyclical process. Global healthcare needs, as identified by healthcare professionals or patients and consumers, are addressed through the generation of research evidence that is effective, but also feasible, approachable, appropriate, and meaningful to specific populations, cultures, and settings. In order to provide those who work in and use health systems globally with world-class information and resources, JBI considers international evidence related to the feasibility, appropriateness, meaningfulness, and effectiveness of healthcare evidence. Includes these different types of evidence in a formal assessment called a systematic review. Globally disseminates information in appropriate relevant formats to inform health systems, health professionals, and consumers, and has designed programs that enable the effective implementation of evidence and evaluation of its impact on healthcare practice. It is this unique approach that is encompassed in the JBI model of evidence-based healthcare. So evidence-based clinical audit and feedback is recognized as a valuable approach to implementing evidence into practice. Recognizing and understanding the role of professional culture, organizational support, and leadership in this process is pivotal to its successful utilization. This approach has been found to be successful in the JBI evidence-based implementation program, where more than 800 healthcare professionals have successfully implemented and changed practice following this framework in both small and large multi-site studies. The widespread impact of the work of JBI worldwide is attributable to the local and global partnerships that ensure that activities are context-driven by individuals and groups that understand their specific healthcare environments. Through its international network, JBI is well positioned to be a leader in producing, disseminating, and providing a framework for the use of the best available research evidence to inform clinical decision-making to improve health outcomes globally. And you can see there where JBI, the collaboration is, and there's over 80 centres of excellence and affiliated groups in all regions of the world. I'll just try and quickly flick through a couple so we can get started on the main. There are many events that are done through JBI gLocal Solution Room, and they're just one way that JBIC entities are promoting and supporting the use of the best available evidence to inform decisions made at the point of care. Before we begin today's session, it'll be helpful to understand the origins of the JBI Solution Room. So what is globalization? Globalization was popularized by the work of sociologist Roland Robertson, who traced its roots from a Japanese business term, dosha kuka, which emphasizes a global outlook adapted to local conditions. Glocalization stresses the idea of contemporary globalization influencing the local level of society and the localization of globality. So what it has to do with evidence-based healthcare is to really recognize the critical relationship between research and practice. That yellow wedge at the top of the model speaks to both the global and locality of evidence-based healthcare. In simple terms, evidence-based healthcare begins and ends with the needs of health professionals, health services, and health service users. Therefore, thinking about the application of evidence context is the key. JBI is cognizant that it is our responsibility to not only provide health professionals with the best evidence, but to support you in its use. Again, that is not possible without connecting in person, without acknowledging and accepting that different cultures and clinical environments present different challenges. And we hope that this event contributes to overcoming some of those barriers, to helping us understand the challenges you are facing and to provide opportunity to generate solutions together in partnership. And the idea of the solution room came from a powerful conference session concept designed to engage and connect attendees, but also provide peer-supported advice on pressing issues. We hope that you enjoy today's sessions and in finding solutions to your evidence-based practice challenges. If you're interested in learning more about JBI or keeping up with the local and global events and news, make sure you connect with us via social and digital media platforms. And if you want to get involved at JBI, know more about our JBI team, then you can contact the JBI Global Engagement Office or contact us at our JBI Centre. Okay. So I'm now going to pass on to Jan, I believe. Let me just get my little email that tells me what I'm doing. Excellent. You've got your screen up. Perfect. Okay, I'll hand over to you.
All right, so I'm providing just an overview of evidence-based practice, and if you'd like to contact me, that's my email there. So just over this short session, I'll just be briefly providing sort of a definition of what is evidence-based practice, what informs evidence-based practice, and why evidence-based practice is important. So, whilst research evidence indicates that nurses and midwives have positive attitudes to evidence-based practice, it's also reported that there is low to moderate abilities to actually undertake specific skills associated with evidence-based practice, including identifying clinical problems, translating these problems into answerable questions, reliably being able to search the literature for answers or having access to the literature, ability to assess the quality of research articles and reports. And this is where you all come in as leaders in nursing and midwifery, and I'm not sure whether we've got some other professions that have joined us, But that's an important one, the ability to assess the quality of research articles or reports, and relatively low levels of confidence in their ability to take and apply best practice. So therefore, having evidence available while training on how to reliably implement evidence into practice is really one of the barriers to better healthcare. So nurses and midwives require the knowledge of the principles and the specific skills related to research and evidence-based healthcare, and the knowledge and skills in how to reliably implement it into clinical practice. So what is evidence? The term evidence is used in the JBI model to mean the basis of belief or the substantiation or confirmation that is needed in order to believe that something is true. And, we're not going to get clinicians to change practice unless they have a belief that a new practice, is better than the previous practice. And it's an important one. So we need to argue that in a systematic way. Okay, so the best available, so what is evidence-based practice? Well, it's the best available evidence, obviously. The context in which care is delivered also needs to be taken into account. The individual patient and the professional judgment of expertise of the health professional that informs this process. So evidence-based healthcare does not eliminate the need for reasoning and reflection by clinicians. In fact, on the contrary, the clinician requires enhanced clinical reasoning skills when deciding which evidence or recommendations to follow. So it's not so simple, for example, when a patient refuses or cannot be treated with an intervention supported in the evidence, although it is obviously the best course of treatment, as even the excellent external evidence may be inapplicable or inappropriate for individual patients. So we have to take the patients into account. It's important to ensure that the evidence-based healthcare recommendations are taken into account in clinical considerations. So by ignoring evidence-based healthcare recommendations, a potentially harmful or less effective intervention may be carried out, while a more effective or cost-effective intervention is available. And as someone used to say to me, you can do the wrong thing perfectly. And I think that sort of rounds that up. So this diagram represents the 4 components requiring consideration when making evidence-based decisions in healthcare. So ideally then, when making a clinical decision, all 4 aspects must be taken into consideration equally. But this may not always be possible. So for example, if it's not so simple when a patient, as I said, refuses or cannot be treated with an intervention that is supported in the evidence, although it is obviously the best course of treatment. But alternatively, the best available evidence may indicate the use of sophisticated machinery for diagnosis, which may be achievable for practitioners, say in the city, but these some machinery or equipment technology may be too expensive, or you may not have the expertise to actually be able to use it, say in more rural areas. So really sometimes the best available evidence actually may be professional judgment and expertise of health professionals, because there's no higher level evidence available. And of course, there are contexts, you've got to take it into consideration. If a context isn't, if it's a culture where the culture isn't one that sort of embraces change, for example, well then, so you have to take all those sorts of things into account when implementing evidence-based practice. So I think it's, there are clinicians that are quite resistant to change, and I think we have to then argue the point of why we need to, what are the benefits of evidence-based practice. And I've just, chosen a few. So evidence-based practice offers safe and highest quality care provision for patients, and therefore improves patient outcomes. It improves patient satisfaction when they know that they're getting the best available care. It meets the expectations of a profession from the public, and reduces healthcare costs, because you might be using a treatment that actually can, you can use something else that's less expensive but more effective. And it reduces, this is an important one, is it reduces variations in practice across settings and geographically. And in doing that, you can also then do, it's easier to do research when you've got, different settings actually using the same practices to see whether, an innovation or a practice is effective. So we know that if nurses and midwives know that their practice is based on the best available evidence, is it improves their job satisfaction and therefore reduces attrition rates. It creates knowledgeable, informed professionals. It makes nursing and midwifery credible to others, the public, to other professions. And it also provides a sense of confidence and empowerment, and a progressive profession that leads from the front and sets its own agendas. So, previously we were guided by the evidence really supplied by other professions. We didn't really, we have now for, quite a while, we're now doing our own research on nursing and midwifery. And so it's, more applicable for us to be leading from the front from our own profession. It's important for a collaborative and multidisciplinary profession, and an evidence-based profession then informs nursing and midwifery practice, policies and guidelines, which Shija will be talking a little bit about as well. I think, one argument for evidence-based practice is the fact that we are regulated. So, the Nursing and Midwifery Board of Australia, the regulation states that we have to be responsible for ensuring delivery of safe and quality care. That's evidence-based care. The registered nurse standards for practice says that nurses need to be able to think critically and analyse nursing practice. And our nursing practice should be based on person-centred and evidence-based frameworks. The decision-making framework for nursing and midwifery states that evidence-based practice applies to all domains and contexts of practice for nursing and midwifery. And also it's absolutely ethical that we practice based on the best available evidence. So therefore the ICN Code of Ethics for Nurses, the International Council of Nurses, states that the nurse is active in developing a core of research-based professional knowledge that supports evidence-based practice. So it's firmly within the regulation of us as a profession. Okay, so I guess the key point from me here is that not all nurses and midwives, need to conduct research, but really we all should be able to know and use and apply evidence-based knowledge to guide our practice. And Hazel has provided an overview of the implementation process or framework, and we could possibly hold another seminar in the future, Tanya, to actually go through the steps in more detail for implementing research into practice. Thank you. I'll stop share. Over to you, Shija.
Thank you very much, Jan. Yeah, I'm going to now move on to Shija, and perfect timing as well. So thank you, Jan.
Unusual, isn't it?
I'll just say well done. Okay, we can
I just want to make it a
see the other
slide.
side.
Yeah.
Yeah, that's the one. Perfect.
Okay.
Thank you.
Yeah, thank you. Thanks, Jan, for having that evidence-based practice as the base, and also like helpful sharing the overall principles of what JBI wants to do as well. So I'm going to touch base on how do we develop guideline and like what standards are. And I'm sure like we can't be covering this. This is a very vast area, and this can't be covered in just 20 minutes. But maybe I can probably guide you to where to look for, and also some examples of guideline development, and how we as nurses can publish the development process and like the process involved, the systematic review, the methodology, and guideline itself. So that's what we are briefly going to see. And as all of us agree, the guideline is the utmost high standard document one should be referring to, and we can appreciate then. So how much trustworthy and like how much we should be depending on guidelines. So then it should be such a extensive process to develop a guideline itself. So NHMRC have actually set the standards of developing guideline. And if you go to the NHMRC site, you can find the guideline, which is even as a live document. You can comment on, you can add your evidence on, things like that. So these are the standards which we keep in mind when we develop the guideline. So the first thing is be relevant and useful for decision making. So when we think of the topic of developing the guideline, we have to prove, or maybe we have to be very clear that is it relevant? Is there already a guideline available? Or maybe even if there is a guideline available, is it appropriate to the context of our care? So if you think that's needed, that's relevant, and then we decide on to make the guideline. And the next thing is to be transparent. So when we talk about transparency, it is the transparency of how you have developed the guideline. So that's what Jan was mentioning about the evidence pooling and each action, what you are recommending. How did you come to that recommendation? So what's the process of developing guideline? So the transparency should be explained, should be detailed in every guideline. And the next aspect is to be overseen by a guideline development group. So a guideline can't be developed by maybe just a group of nurses or group of doctors, or just one discipline. It should be developed by multidisciplinary group, including the end users. So when we say including the end users, so maybe for example, you're developing a guideline on infant feeding. So you should have maybe parents and parent support group in the reviewing committee. So that's the recommendation. So it should be overseen by a guideline development group, and there should be representation from every group as well. So that standards can be detailed. You can find the details of this in the NHMRC website, but otherwise, like it should be a representation from every group. And identify and manage conflict of interest. In order to identify the conflict of interest, we should be well informed about the guideline itself. Now, maybe for example, the guideline group is developing a guideline on infant feeding. And imagine you have someone in the group who is promoting the infant feeding, like maybe the formulas. So you have someone, I'm not saying that you shouldn't have them, but what we have to be very clear is that like a purpose of the guideline and the process of guideline and any conflicting interest should be well defined before we form or before we start the process itself. And if there is any, that should be well detailed in the guideline, that what was the significance of that person who may have the a conflicting interest. So that should be declared. So identifying and managing the conflict of interest is very important. So that's one of the standards. and be focused on the health and related outcomes. When we say that again, so again, for example, if we are developing a guideline on infant feeding, it should be detailed in the guideline. What's the benefit of this guideline for the child and for the mother? So that should be included in the guideline itself. So what's the outcome? What's the purpose? Why are you developing this guideline should also be there as a purpose or scope of practice in the guideline. Be evidence informed. As mentioned, this is the ultimate evidence. So people can just trust on, it's a real document which you can follow. So that means that it should be informed by the best evidence. So when we say best evidence, it's not just one systematic review which you conduct or which has been informed by one systematic review, but it is it's a real process of pooling all available data, including how much of trustworthy by grading that evidence. So it should be evidence informed. So what we say as a golden rule, no guideline can be developed without a supporting systematic review, at least one. So all available evidence to be pooled and graded for evidence when we develop the guideline, and make actionable recommendations. So guideline is not just some instruction, it is with action and when to perform and in what context it can be performed. Each recommendation should be linked to the evidence and should be graded. I'm just going to show you the example of the guideline so you will appreciate each of the standards, especially the NHMRC guideline, how they meet these standards. Be up to date. So when you take any guideline, you can see that when it was developed and when is the time for review. So each guideline should have a recommended update suggestion date. And we don't really have to wait for that date. If we have new evidence, then we are supposed to be updating it. That's what we can see in the NHMRC site, that you have the live document. So maybe, for example, regarding the infant feeding, you have conducted a systematic review and you have the evidence, and you still can see the guideline is recommending something else. Then you have the option to comment on the guideline and attaching this evidence. So the guideline development group can review your recommendation and update. They don't have to wait for the time to review, but they can update it then and there. Be accessible. So I think that's one of the main things. We may have the guideline, but that may just be for your unit or for your hospital. So we don't know what others are following. Maybe others really want to have that guideline, but you haven't made it accessible. So in order to confidently make it accessible, that should really follow the standard. So that's why we have this standard, which is recommended by the NHMRC. And when it is made accessible publicly, then you acknowledge that this guideline is meeting the ultimate standard. Let's look at some two of the guideline which has been published. So this is, I don't know if you can still see this. Can you? Yeah, okay. So yes. This is the best, thanks. The best practice guideline, which is developed by nurses. This is on vascular access and published in June 2021. And this is developed by Registered Nurses Association of Ontario. And you can see that, just to show you whether this is meeting the standards. So they have the introduction of how to use this document and the purpose and scope of the guideline which they have developed. You can see the scope here. And they have the key concept to this best practice guideline. And you can see there are 7 recommended questions which is detailed here. So they have 7 questions, and all the 7 questions they are going to assess or maybe answer through this guideline. So that's what we are going to look at. And I would also like to show you, this is the infant feeding guideline, which is published by NHMRC. And you can see that how well published and like how well informed this guideline is. So that gives you an introduction and like some concept detailing. And this also will tell you about like what are the benefits to the mother and benefits to the baby, and all the recommended practices, the scope of practice, when they are expecting that to be renewed, the structure of the guideline, intended audience, etc. So any guideline should be following the NHMRC standard to make it publicly accessible. So now looking at some of the steps in developing the guidelines. So you have decided and you have the standards which you are sure like which you're going to follow. Now let's look at what are the steps in developing the guideline. So first and foremost, it is forming the questions and then identifying the evidence, selecting studies and data extraction, synthesizing evidence, assessing risk of bias, certainty of evidence. So these are the steps of developing guideline. And once you develop the guideline, you need to implement them as well as disseminate them, review them, and update them. We cannot cover all this. So we're going to just touch base on this aspect of developing guidelines. So firstly, forming the question. So we have background questions and foreground questions. So background questions generally talks about like, why do you need this guideline? So you are going to say, what's this condition? What's the burden of disease, priority condition, and what's the current practices or policies? And the next is the foreground question, so which talks about what are the effects of this intervention. So that's what I have just shown you in the vascular access guideline. They have developed 7 questions, which is normally based on PICO, if you're aware of. So PICO is the format, the population or the interest, and also the intervention and outcome. So normally we follow the PICO questions, and this is generally informed through a systematic review. So in the vascular access guideline, I will also show you, they have published the guideline, but before publishing the guideline, they have published their systematic review on those questions. So that's showing that it is a very well informed guideline, and which is publicly available because it's published. And then we have the recommendation or decision question. So each action, how is that connected to the evidence? So they have this recommendation with each of the evidence connected to how many studies or maybe how many systematic reviews inform this action, and you grade them. You grade that recommendation. So this is the first and foremost, most important step, that we form a question for the guideline. And next is identifying the evidence. So how do we identify the evidence? Like all of us get support from the librarian. Either we have a librarian in the hospital or we are connected to a university. So none of us are expert in accessing the evidence, and it is always advisable that we get advice or support from the librarian. But first thing before we go to the librarian is to have the keywords. And how do we get the keywords? Are from the question which you have developed. So we develop the question, we use the keywords, and then we decide on where to search. So CINAHL is one of the commonly used platforms. We, for a systematic review, we use, depending on what question you have, so we use CINAHL, Medline, or maybe sometimes Corpus. And if you're very specific to the topic, you may also search for gray literature, like any published guideline itself, any previously published guideline, any policies, any conference proceedings, etc. And then you filter. Maybe there is a guideline already published. Then you want to filter. So the guideline has been published in 2016 and you're updating it. So if you're updating the guideline, and if that's a very well conducted and the process is very clear, then you don't want to do the search before 2016. You want to start the search from 2016. So you make that filter. And then how do you manage the identified references? Normally, this large references cannot be managed manually. So we use the referencing managers. Mendeley is a free platform. Otherwise, you can use the EndNote if that's available. So when you have this, you pool this data. So again, a guideline development cannot be done individually by a single individual. It's a teamwork. So we screen this, we pool all these searches, which you would have done it with the help of the librarian. And then you get, say this is from maybe Medline, you get such a number of studies. And then you also have some gray literature on the other hand side. So you pull them together, put them into the reference manager like EndNote or Mendeley, and then you start screening. You look at the title and like you screen the title and then the abstract and the full text. Maybe if you haven't done a systematic review, what I'm speaking is like maybe little difficult to follow, but we do conduct a workshop on conducting this systematic review, so which will be very helpful if any of you are interested. So, but otherwise, this is the methodology we follow to include the study for considering for your guideline development. So it should be a systematic process of search in identifying the study. So this is the format we follow. That's accessing or identifying the appropriate study. Now, once when you have decided these are the studies which may give answer to the question which you have, then we need to synthesize the evidence, pool the evidence together, and that informs the action. So sometimes you may need a meta-analysis by using statistical help, and that informs how much trustworthy the information will be, how significant is the information. And also sometimes it can be a qualitative data, so which you can use for use by the synthesis. And you pool the data and you map it with your research question. So that's called synthesizing evidence. You have to also be vigilant about assessing the risk of bias. You're developing a guideline which is to be used in Australia. And if your studies, what you have is been published elsewhere, which may not be a very good, studies to answer the research question or to develop the guideline. So for example, like the selection bias. Now you're developing a guideline for infant feeding, and you have a study which has assessed the children from maybe other countries, so which may not represent you the guideline for the children in Australia. So that's the selection bias, performance bias or confounding factor. Maybe there is a study which is done on infant feeding, and they found that maybe breastfeeding is not beneficial. But those participants who are involved in the study were maybe a chronically ill children. So that's a confounding factor in the study. So we have to really be looking at individual study or the systematic review in detail to identify if that is a study which can inform the guideline. Detection bias and attrition bias. So maybe when you say like the outcome of the intervention or maybe the infant feeding is only for those who had the beneficial outcome have reported after the intervention. So there was a lot of them, we lost those who didn't have the impact. So these are the attrition bias. So it's important that we assess the certainty of evidence individually. So we have something called grading the evidence. So we plan your approach to ascertain the certainty. So we have a plan, like how will we assess individual study, how we approach individual evidence. So one of the method is that like you appraise the study. So we have appraisal tools available. So when you have this pooled study, so for example, your guideline are informed by maybe you have selected 30 studies, which includes systematic reviews, maybe some qualitative studies, and maybe some observational studies. But you're going to look at individual studies to assess the certainty of evidence. You don't have to be 100% certain. You can look at the grading and say, this recommendation which I have, which the guideline have, is of not very high evidence supported, but what is available is the recommendation. So there are many ways of assessing the certainty of the recommendation. Now let's look at like how people publish again. So when I said this vascular access guideline, they had this question. So they had 7 questions. They did have the study published. So you can look at this if you really have to be, like you want to adopt that guideline for your practice. So then you look at the systematic review, or maybe you're developing the guideline. So please conduct and publish the systematic review. That will inform that, this will always be supported. The guideline is supported with the systematic review. So that's how like you get the publication, and that evidence is attached to the guideline, and anybody can access. And maybe sometime you may want to update the guideline. So you do the systematic review, search again. So that's called updating the systematic review. So if you have to update the guideline, the first thing to do is to update the systematic review to look for any evidence. So this is a very systematically followed. Also, I'm showing this because it's conducted by the nurses. And so this were the research question. So they had 7 research questions for their review paper. And you can see like how they had the eligibility criteria. And this is what we were talking about, the grade certainty of evidence. So they have the high, moderate, low, and very low. So they also identify like which recommendation has the high certainty of evidence and moderate to low and very low recommendation. I am happy to send you all these documents for your further review, because in this short period of time, maybe it's hard to follow everything. So we will send you all this, the documents. So it's very interesting to learn for each recommendation, how they came to that conclusion or action items based on what certainty of evidence. So you can say that the strength of recommendation is strong to conditional. So when you may want to take in consideration of this recommendation, then it's safe that it is conditional. So that's the process of developing guideline. Now we only have developed. We need to implement them, and we need to disseminate and communicate them. And it's a continuous process. So you have planned, it is the first step is planning and a strategy, selecting channels and materials, developing materials and pre-testing, implementation, assessing effectiveness, feedback to refine the program. So this is a continuous process. So we have developed the guideline, we need to implement them, and we also need to disseminate them and make it publicly available so people can use them. So these are some of the examples of like we do develop guideline. Most of the time we do not publish them. So this is what I wanted to show you. So the guideline should be made available publicly. Maybe it can be in your hospital site. I can see many guidelines which is made available like in the NSW Health site or so publicly available. So this is one of them which I can show you. And this is a systematic review paper which they got it published by developing this guideline. You can simply press publish the methods you used in the development of guideline as well. So you can have many publications, and that increases the strength and certainty of the guideline. As I know, we have had just a glance of developing guideline and also the evidence-based practice systematic review. Either it is good to also share with you that we are going to have a workshop in next month. That's from 18th till 25th. This is a 5 days workshop, and which is completely online. And we can provide you more information, which covers many of this aspect of how do you develop the question, how do you conduct the systematic review, how do you appraise the document, how do you appraise the study and publish the systematic review. So happy to give you more information about the upcoming systematic review workshop as well. Thank you.
Wonderful. Thank you very much, Shija.
Thanks, Hazel.
Excellent. Okay, so now we're going to move on to a discussion being led by Tanya. Now, the Q&A is the best way for you to talk with us because the webinar chat is doesn't seem to be working for our attendees. It's disabled, but you can put things into the question and answer. We've had a couple come through. So yeah, Tanya, over to you for the discussion, and I'm happy to keep an eye on things on this side.
Hi, thank you. So yeah, as Hazel mentioned, if anyone's got any questions, please pop them into the chat. But I can see that Jan has kind of posed a few questions to the group, if anyone wants to be able to answer those. So can the nurses and midwives in your clinical areas appraise research articles? What do you work in a clinical setting that embraces change? Does anyone have any comments or any questions?
You can also raise your hand and we can even allow you to speak out your question.
Oh, perfect. That's good.
Or pop it into the question and answer.
So if you think appraising the articles, like maybe just looking at the quality of whether when you want to answer a clinical question, and if you're not very sure of like how do I know whether this is a study which I can trust on, that's where we look at the like we use the appraisal tools, which is very handy. And yeah, so that's
we do have a question in here from Sonia, just saying funding sources and a question mark.
You can see the question there.
Yeah, and an indication of cost for guideline development under the question and answer section.
Okay.
Okay, under open.
Okay.
Anybody have any? You can add that, Jan?
I think, I'm not sure. Oh, we're providing funding sources. Is it where they're getting funding? What for exactly?
Yeah, for the cost for guideline development.
Okay. Well, that's an organisation. I think that is an organisational issue too. Are you getting, well, I think it's under the remit of clinical nurse consultants, am I right, that they develop the clinical practice guidelines?
Maybe Tanya can have a
yes, well, Tanya, I'm sure you do it.
Yeah, so that's a very, very common part of my role. And I find that within kind of funding sources, it is just kind of through staffing and your resources that you have within the hospital. So quite often when I'm updating guidelines, it's doing the kind of research literature reviews that Sija was talking about, and getting all the resources and the information and the research that's available, and then getting a team of people together, so kind of multidisciplinary, like we mentioned, so getting nursing, medical, allied health if they need to kind of start drafting the policy with the evidence-based literature, and then kind of going through our own hospital policy and procedure team, who then kind of do further reviews and send them out to further independent people. So there's not necessarily any extra funding that would come for that. It's kind of all within the staff and the resources that we already have available within our hospital team. Does that answer the question? I hope so. There's another question come through.
Oh, this is a question relating to guideline development in the cancer space, not nursing, and really interested in the costs of outsourcing services to JBI. What would a costing allocation be for JBI to support project and manage?
That's a great question. I know that JBI do that work, and I think we could give you the contact for the person at JBI that provides support as well, or actually they also develop clinical practice guidelines. We certainly, our centre is mainly concerned with workshops and education. So the cost of outsourcing services to JBI, we could definitely give you the contact for that, Sonia, if that's what, if Tanya gives us your email, we can email you that information.
I don't have her email address, unfortunately, but
I do
somebody
have the
hopefully will.
details.
Perfect.
Okay. All right. We'll write that one down. Yeah. Very good.
Yeah.
Great question.
Yeah, Shiju would have that one. So I'm just going to click done on that one. And actually she's put her email up there.
Yeah.
Terry has jumped on to ask, can you tell us more about the 5-day training in July, please? Do you have to attend all the days, or is the training split into different types of systematic reviews?
Yeah, I can take that. Let me share the screen. Okay. So this is 18th, 19th, 21st, 24th, and 25th of July, and this is fully online course. And the first day is the introduction to evidence-based healthcare. So that's mandatory, or whether you can either choose to attend just the qualitative part or the quantitative part, or both. Like, so if you're attending just the quantitative part, then you attend 3 days. So that's 18th, 24th, and 25th. And if you, so quantitative. And if you're attending the qualitative part, you attend 18th, 19th, and 21st. If not, these are all 5 days. And the cost for the 5 days workshop is 1,500 and 900 if you're applying for 3 days workshop. And this will be, the registration will be closing next week because we need to register, by next week. So I'm happy to give you more information, and I'm happy to send the flyer if you require for all the participants as well.
Excellent questions. Thank you. Any other questions to come through? We've got about up to 5 minutes more, so we can answer some more.
Can I ask a question of those attending? I mean, you've attended this for a reason. Are there particular challenges in relation to evidence-based practice in your clinical settings? I'm not sure whether you're all in the clinical settings, but because that tends to still be something that certainly my students, when they come back from practical, that that there are certain challenges and obstacles, barriers to implementing evidence-based practice. Or have you implemented any facilitators that can assist others that has facilitated the introduction or of evidence-based practice? Is it what would be the barriers in your clinical settings? Is it a time thing? Are you supported by the organisation to undertake research, or
While we're waiting for comments, I could maybe give some from my point of view.
Yeah.
So certainly within my clinical area, a big barrier I think is time and just kind of clinical workload. That can be a really big barrier to being able to have the time to look at what's the best evidence-based practice that's around. So that's definitely one of the biggest barriers is time and just the availability to be able to do that. But being able to call in our librarians is such a big thing that really does help if they can help to do some of the work on looking at the research and getting that kind of research available to you. But time is definitely one of the biggest things, and just the clinical workload can be huge and doesn't leave much time sometimes for the evidence-based practice or getting the evidence to update your practice.
So clinical nurse specialists then have a heavy clinical load as well?
Yes, they can do. I guess it depends on which role they're in as well. They can have a heavy clinical workload, or they could have lots of other aspects, like if they're doing kind of opening new services or clinical service development. And it just kind of depends. It kind of ebbs and flows, I guess, and it depends on the role. Some people might have a more clinical role than others, but we can find that that's, yeah, one of the barriers that can happen. I'm not sure what other people think from other areas. We haven't had any comments or questions as yet.
I mean, there's so much information now coming out, isn't there, that it's difficult to keep up with the latest research. And
Yeah.
I suppose, yeah, that's why we're really passionate about doing systematic reviews, because they do the integration, the synthesis of all the evidence into, you know, one document. And, you know, we do Cochrane reviews as well. If there are any, if there's anyone that are interested in joining us to write a systematic review, we're always happy to mentor. We all started, you know, with that first one. And, you know, they're quite complex. They really are. They can be very complex. And so, you know, it's good then to get a team so that you distribute the workload out. And there is an expectation for you, Tanya, to be involved in research, you know,
Yes.
as a CNC. Well,
Yeah.
what we do is we create teams, and then we distribute the workload out to the team. So you're still getting the, you know, an authorship on the publication, and that goes towards your CNC. And I'm sure there are those clinicians that want to, you know, sort of go up the ladder, so to speak.
Yeah.
And it's a great way, you know, to get on a team, to write a systematic review. It's a great way then. And, you know, they're a great training ground as well, aren't they, Hazel and Shisha?
Yeah.
They're a great you learn about quantitative research and qualitative research and analysis and data collection and all the, you know, the fundamentals of research. So, yeah, if anyone wants to join us, I'm sure
Well,
Hazel's got a few.
Kavita is saying that she'd love to do a systematic review with you, Jan.
Oh, who's that?
Kavita.
Kavita has put a comment on
I
the
can't.
Click on the little Q&A.
Okay. Oh, Kavita. Hi, Kavita. I know Kavita, and we've done a systematic review. You are my old pal. I know.
Excellent.
Yes,
I would also love to do a systematic review with you guys, actually, in all honesty. That would be something I'd be very interested in too. So
absolutely. We'll get a team together, Kavita. That'll be great. Yeah, I did one with Kavita. We had great fun. But they're not, you know, I mean, they are a challenge. And I think it was when we were sort of starting out writing them, I think then Kavitas are a little bit more experienced at them, but they're still a challenge, and it's great to, I think the big team is I've realized it's a big team. So, you know, if you got 4 or 5 on a team or even more, you know, you can distribute the work out, and then it doesn't become overwhelming. And so I will get in contact, Kavita. Yeah.
She said that I can collaborate too, so that's nice.
Yeah, of course you can. Absolutely. Yeah.
Oh,
And
Gillian
and
Gillian.
And Gillian, oh great.
Oh, great. You know, because
You've got a team there now.
Yeah, every Cochrane review I've ever written has come from clinicians saying, yeah, we need to do a systematic review on this. Like, I'll give you an example. We did one on intravenous filters, and had clinicians working in the neonatal intensive care, and the management was saying we should be using filters, but the nurses and midwives were saying, well, what's the evidence? And so we formed a team, and then we looked at what was the evidence for using intravenous filters for babies, for neonates. And it was fascinating. You know, when you start reading the literature, we found that, you know, they've even found rubber. I think there was even a crab claw, you know, a piece of crab claw found in IV fluids, because, yeah. So, you know, and then I thought it was only about bacteria, but then you're talking about endotoxin. I learned a lot. You learn a lot. You actually become an expert. Kavita, we did one on chest shielding during phototherapy, and to see, because there was there was a concern that phototherapy actually opened up the patent ductus arteriosus, and I can't remember the mechanism. Anyway, so we did a review on that, and I think there's another study out too, Kavita. We could update it. Yeah.
That's so fascinating. Well,
And
we
it's
have come
fun.
to our time, because we only had 1
Oh.
hour for this. So if there's any final comments from any of the panelists or anything that's come through.
I hope you come to the workshop. We do have a lot of fun.
Yeah, come along to the
and
workshop.
it's
get in
online.
contact.
It's online. You can just come for 3 days. So
Excellent. All right. Well, thank you very much for everyone for coming along and taking time out of your day to listen to us and get excited about JBI systematic reviews and other reviews that we can do with it. So lovely to see you all. And thank you for coming.
Thank you.
Thank you.